Think about how you get healthcare now versus back in the day.
We've gone from a generation of physicians who were always on paper or kind of an analog, and now to a generation of physicians who have always been digital. And I think it's an interesting dynamic in healthcare. And we're really trying to eliminate some of that burden when it comes to patient care through the technology and transformation.
From artificial intelligence to shifting patient care models, healthcare delivery is undergoing transformational change. We learn how it's working through the eyes of a Central Indiana doctor.
So at the end of the day, healthcare is still people taking care of people.
Community Health Network Chief Transformation Officer Dr. Patrick McGill talks technology, accessibility, and the biggest challenges facing the healthcare system in Indiana on this edition of the Business and Beyond podcast. Hello and welcome to the Business and Beyond podcast presented by PNC. I'm Gary Dick. In this episode, we dive into the evolving world of technology in the healthcare space, how it's driving the way doctors treat and patients receive healthcare. And I'm pleased to be joined on the podcast this week by Dr. Patrick McGill. He is the Executive Vice President and also Community Health Network's Chief Transformation Officer. Patrick, thanks for joining the podcast.
Thanks for having me.
Absolutely. So Chief Transformation Officer, probably no field that it continues to be in as much transformation, if you will, as the field of healthcare and medicine. But in your role, which I'm sure, I don't know how many years ago it would have been, didn't exist to have a transformation officer. Now, very important role. What's it? How would you capsulize, how would you describe being a Chief Transformation Officer at a major health system?
Yeah, so first, I appreciate you having me on. I think that the way we think about transformation is what I do is challenge myself and my team to wake up every day thinking about how we can improve the care that we deliver, whether that's how we deliver care, the experience that people have receiving the care, how they interact with us, the access, how they access the care. It's really how do we drive change? Because to your point, healthcare is constantly changing. Healthcare is changing. It's changed over the last 50 years. I've been in practice 20 years, and the way things are today are completely different than the way they were 20 years ago when I finished my residency. And so how do we systematically identify opportunities and then implement those so that we can stay relevant and patient-facing and deliver high-quality care?
How does that change the way healthcare is delivered? Obviously, the digital age, and we'll talk maybe in a little bit about artificial intelligence, but digital technology is certainly transforming all industries, including healthcare. But medicine is such, a unique field where that personal touch, the so-called bedside manner is important. How do those two kind of coexist in the world today?
So at the end of the day, healthcare is still people taking care of people. Still physicians or APPs or nurses or pharmacists taking care of other people. So I think the way we see the use of technology or the interface of technology is there's a lot of things that happen in healthcare that we can make more efficient. It's a lot of friction in healthcare. If you think about your own healthcare experiences, how do you get an appointment? How do you get reminders? How do you interact? How do you register? How do you interact with your insurance company? How do you get your results? How do you get referrals? How do you schedule for testing and other things? So how do we make that experience more seamless with less friction? And it goes back to what we want to achieve is the experience that people have in all the other aspects of their life with less friction. Think about how you shop now, how you bank, and how you interact with other industries. People have come to expect that level of convenience and interaction, and we need to do the same in healthcare. So to your point, we're not aiming to disrupt that clinician-patient relationship because that's very important and still at the heart of healthcare. But how do we make all the experiences and interactions around that more seamless and frictionless?
How is that process unfolded in your view? When you arrived at Community, I think you were involved in informatics. You've always been around that technology, digital side of things. I remember doing stories, and I think Indianapolis, as I remember, I think Regan Streif, a leader in going to digital medical records and those types of things, and the resistance that was out there from doctors and maybe patients as well. Talk about that whole process, because I'm sure it hasn't been seamless. It was probably a challenge, but now pretty much just part of the everyday order of things.
Well, it's like everything in a lot of other projects or changes, transformations, it's change management, right? All change it can be difficult. And I mean, just in my short career, when I started, I was 100% on paper, had to write every prescription by hand, paper charts. And now I can't tell you the last time that I wrote a paper prescription. And now what we're seeing is newly graduated residents have never practiced on a paper chart. Yeah. So that just tells you kind of the whole shift in care delivery, that we've gone from a generation of physicians who were always on paper or kind of an analog, and now to a generation of physicians who have always been digital. And I think it's an interesting dynamic in healthcare. Some, what we call digital natives, really take to it. Others lean in and understand that this is the way that we deliver care. And I think others understand that we make their job more efficient. We allow them to get back to doing what they are trained and love to do, about taking care of patients. And we're really trying to eliminate some of that burden when it comes to patient care through the technology and transformation.
Yeah, I would assume efficiency is a big piece of that. As you look, Dr. McGill, at the experience for the patient and the role that technology has played, continues to play, talk about how the patient experience has changed, maybe some examples, old school versus today, on how technology is really a game changer.
Yeah, I think one of the biggest in the last couple of years has been the transparency and release of information and results. So a federal law that was passed, a rule that was passed 6 or 7 years ago, is actually under the Trump administration. It's called the information blocking rule, that you have to release information immediately, labs, results, imaging, as they come through. And so, previously you would get a CAT scan or an MRI done. You would sit around and wait for your provider to call you with the results. That might be 3 days, might be 5 days, might be 7 days. Now you have those results at the same time your provider does. So that's good and bad. It's good that information is flowing to the patient where it should. Sometimes it creates a little bit of anxiety, especially if there's an abnormal finding or a not so good finding. But it really has forced us as providers to understand that experience and really not allow 7 days to go by waiting on a result. So that's a good example where technology has improved. Transparency of progress notes and what's happening, really allowing the patient to become part of the care team. I think technology has enabled that. We can talk about many of the other things: online scheduling, online check-in, online bill pay, online, all those other things. Like I said, and they're common in other aspects. Nobody likes to pick up the phone and call to schedule an appointment, right? They all want to do it on the phone or online. And I think that's where technology has enabled that.
How about, for lack of a better term, I don't know if it even described as that these days, but telehealth. That remote, connectivity, which I'm sure really came into focus during the pandemic, of course. But how has that continued to change things? And talk about, if you would, as part of that, access, especially for those folks maybe in rural areas or lesser populated areas, and how they're faring in this world.
Yeah, where we've seen a lot, obviously you're right. During the pandemic, a lot of adoption of telemedicine and telehealth. And I think that we've seen some pockets where it has stuck. Certainly acute sick visits. We see a huge increase in people getting access through telemedicine that way. When it comes to chronic disease or chronic follow-ups or routine follow-ups, we see a mixed bag. We see some patients who still want to have that in-person visit, and that's their choice. Others are more comfortable, depending on what conditions they have or their provider, like you said, how far they're driving might drive some of that. I do think that telemedicine has allowed access to specialty care in areas that have traditionally been underserved. And so when you think about teleneurology, teleinfectious disease, even telesleep medicine, some of those specialties where people are driving an hour or more to receive care, these are specialties that are very amenable to virtual care. And I think that has been a very positive aspect as well.
How would you assess, and I don't know if you can really address this, but the state of healthcare? I want to talk more broadly, but in particular for rural hospitals, which I know many have financially struggled and are challenged. But in terms of the overall state of healthcare in Indiana, how would you assess that, with a special maybe focus on how some of these rural communities are able to be served?
I think the state of healthcare in Indiana is actually positive. We have a lot of the foundation in the building blocks that we need to really compete and be great on a quote national scale. For example, you mentioned Regan Street. You mentioned Indiana Health Information Exchange. We have data. We have data flowing. We have technology. I think you're right. There's a lot of health systems that are struggling, but we've seen a lot of businesses struggling over the last few years. We struggle in healthcare with the labor market, just finding folks, nurses, doctors, clinicians, non-clinicians to work. Previously, to hire somebody that would be your front office staff or answer the phones, they had a calling in healthcare, and now we're competing with the Amazons of the world and some of those other industries that we historically didn't compete with. And so I think that has led to some challenges. I think we often think about, in healthcare, we think about the aging population. And I think, to your point, those rural areas are probably aging a little bit faster than maybe the urban areas, as the younger people are attracted more to the urban areas. We see those rural areas aging faster, and that's creating more strain on the health system as people are developing cancer and more chronic diseases, et cetera. So I think Indiana is like many places in the country. We're going to be in a pivot point in the next couple of years. We're going to really see how the system can flex with, again, an aging population, workforce challenges, some of the financial challenges that the economy is going to bring on. And I think it's going to require all of us to lean in and be creative and innovative to solve those problems.
Yeah, you mentioned workforce, and certainly talent is a big issue across all industries, affecting everyone. In particular, healthcare. There's a lot of talk about the nursing shortage and some of those kinds of things. How is the industry, and maybe you could focus maybe a little bit more here in Indiana, dealing with that? I know Ivy Tech and others have got a number of programs aimed at kind of trying to fuel that pipeline. But how do you think Indiana is handling it? And you mentioned that kind of that flex point, maybe a couple of years out. What might we see take place here in the next couple of years?
I think Indiana's actually responded very well to the labor challenges. I think you've seen a lot of collaboration between the university, the training systems, and the health systems. I talk to my peers across the country, and there's still markets that are really, really, really struggling with labor, especially with nurses, patient care techs, some of those types of roles. And I think, like you mentioned, the partnership that we have with Ivy Tech to really capture some of those students in high school, right out of high school, train them. We have a great program partnership with Ivy Tech for a medical assistant to nursing program. It's an accelerated program that has been very beneficial. And I think we just need more and more of those programs. We need more people that are interested in going into healthcare. I think that's the challenge. I think we have one challenge of training people, but I think we have another challenge of just, again, getting people interested. And that starts in middle school. It starts in high school. It starts early to get people really interested in going into a healthcare field.
Yeah. How about for doctors? Because certainly the financial landscape over the years has changed dramatically. Are there enough doctors, men and women, doctors coming out to fill the system?
I don't know that we'll ever have enough doctors. I mean, in my 25-year career, we've always talked about a doctor shortage. It takes a long time to create a doctor. It takes a minimum of 7 years after college and a max of, and sometimes up to 15 years. So it's just a long runway to create doctors, and you're constrained with residency slots and medical school slots. The medical schools have expanded, but the residencies haven't expanded as much as the medical schools have. So there's just a whole chain of events that has to occur. And so I don't know that we'll ever have enough doctors. And again, as the population ages, it just puts more strain that we need more and more doctors. And so you see the rise of advanced practice providers, and that can fill a gap to a certain degree. But there's not enough of those either. And I think it's just challenges all the way around. But again, it goes back to, how do we get people interested and excited about going into healthcare?
Yeah. Certainly the healthcare profession, medicine, very competitive. Competition, I think most people would say, is very positive. You look around the marketplace here in central Indiana, and you see Community and Ascension and IU Health and all the big names around with big investments in physical plant and specialties. What's the key to being, in your view, aside from great customer service and all those kinds of things, but in terms of competing in this kind of ultra competitive marketplace? Is it specialty, coming up with specialties, or what's kind of the magic sauce maybe from a competitive standpoint in the hospital business?
I still think it's access. Talk to any of your friends, and one of the biggest dissatisfiers is, hey, I needed to get in and it took me 4 weeks to get in, and others. So I think first and foremost, it's access. If you can't get in, you're not going to win any challenges or battles if you can't see people and treat people. There's been a lot of conversations over the last couple of years around cost of care. I think cost is important, right? We all understand that cost is important. Cost is something that everybody is dealing with. Health systems, employers, Hoosiers, everybody's addressing this cost of care. And I think that's important. So how do you win? I think it's access. It's delivering high quality care at a great experience. And I think we're blessed in Central Indiana that all the systems actually deliver high quality care. Yeah. I think that there's a lot of reasons that we can compete, and a lot of things that we can compete on. And there's challenges too, that we can come together and address.
In terms of challenges, I know one of them impacting the system would be just the healthiness of Hoosiers, or maybe the lack of healthiness of Hoosiers. I know the Indiana Chamber of Commerce has made that a focus at legislative efforts the last couple of years regarding smoking and some of the other health issues and the impact that has on the system. What, in your view, put it in perspective, if you could, being in Indiana here, and we're not, again, really healthy state, how important or how negative a factor is that? And are there things being done? Do you think enough things are being done to maybe mitigate those issues?
Well, statistically, only about 20% of your overall health, is based on what occurs within the four walls of a health system, impacted by a physician, impacted by being in the hospital. So the other 80% is where you live, how you exercise, your weight, smoking, how much you drink, all of those other social determinants of health, your education level, all those social determinants of health. So the number one way to improve your health is actually improve your education. We know that there's a link between education level and health. Obviously, education's tied to income. All of these things start to come together. So there's things that a health system can do. Certainly we can provide, or a physician, we can provide education, we can provide some of the treatment. But how do we go flip from a system of sick care to a system of well-being and healthcare? And I think that requires all of us, to your point, the chamber, businesses, government, health departments, everyone has to come to the table, religious and cultural leaders. I mean, I think to your point, the challenges that we have, if you said, what's the one thing that keeps you up at night? I think the one thing that keeps me up at night is, how do we come together to address the social determinants of health and the aging population? I think those two things are really going to put a strain on the health system in the next 10, 15, 20 years.
Well, much more ahead with Dr. Patrick McGill. He's Community Health Network's Chief Transformation Officer. When we return, we'll talk a bit about artificial intelligence, certainly top of mind for many of us these days, and will continue to be so. That and much more when the Business and Beyond podcast continues.
At PNC Bank, we're committed to making a difference in the lives of our customers and communities by helping them move forward financially. As a Main Street bank, we try to do right by our customers with every encounter. Our local teams offer personalized financial advice to help guide you in making the best decision. We're proud to be part of your community. PNC Bank. See how we can make a difference for you at pnc.com. Copyright 2022, the PNC Financial Services Group, Inc., all rights reserved.
And welcome back to the Business and Beyond podcast presented by PNC. My guest this week is Dr. Patrick McGill. He is Community Health Network's Chief Transformation Officer. And we've been talking a lot about transformation in the world of healthcare and healthcare delivery, technology, and its impact. He is Community Health Network's Chief Transformation Officer, and we've been talking a lot about transformation in the world of healthcare and healthcare delivery, technology, and its impact. But Dr. McGill, before we get into AI, let's talk a little bit about you and your path. How did you talk about you wanted to get more people, interested in medicine? What piqued your interest, and how early was it that you thought, you might want to be a doctor?
My interest really started when I was in high school. I had a family doctor, and I'm a family doctor by background. Had a family doctor that I grew up with, and really enjoyed. Thought that's kind of what I wanted to do. Went to medical school and wasn't exactly sure, and eventually through a mentor that I had, a rotation. Actually, I'm from Georgia, so I went to medical school in Georgia, in South Georgia. Rotated with a physician that was a family physician for many years, and I saw the relationships that he had with many of his patients, and came back and decided that's what I want to do.
Yeah.
I came to Indiana to do my residency and worked with another health system. And then in 2010 came to community and have been here ever since.
Yeah. So you grew up in Georgia?
I did.
Good. And then how did you went to medical school in Georgia? What brought you to Indiana?
I came to Indiana to do my residency. I did my family medicine residency in Muncie at Ball Memorial, and thought I would be here for 3 years and go back to the South. And 22 years later, I'm still here.
Similar story. A lot of people, we're going to be there a couple of years and end up staying here for good. A lot of our conversation has been on technology, and certainly artificial intelligence is permeating all industries these days and changing the way we do so many things. How is AI impacting? You probably have a whole hour on this, I would imagine, but how is AI impacting healthcare and healthcare delivery?
I think we're really at a tipping point for AI in healthcare. So we've taken the approach that there's a lot of opportunities in healthcare to automate and remove some of the waste, to remove some of the inefficiencies. So one of the biggest projects, the best examples that I can give you is what we call ambient listening in the exam room. So AI listens and then listens to the conversation and then will transcribe the note. And it does an amazing job. It weeds out some of the extraneous information, really documents the core information. But what it does is it allows the providers to focus on the patient, make eye contact, not be focused on the computer. It really has brought a lot of the joy back in medicine because it allows you to not feel like you're attached to a keyboard, but really focusing on the patient. And so it allows people to finish their notes, finish their documentation, not have a bunch of pajama time that we call. So that's one example. Other examples would include some of the early detection systems that we have in place now. So when patients are deteriorating in the hospital, having AI to give us a warning before a clinician may even realize it. And so those types of systems will deliver better care. And then, of course, there's a ton of automation when it comes to how do we do prior authorization and billing and appointment scheduling, et cetera, that just, again, allows people, the clinicians, to focus on being clinicians.
The technology and what AI can do is really mind-blowing, and so many positives to it, but a lot of people are scared about some of the negatives, some of the downsides, maybe some of the ethical questions that might come into play in the world of healthcare. I talk about some of those things, Dr. McGill, that you see some of the ethical concerns that need to be addressed, and again, some of those guardrails maybe that need to be there when it comes to AI?
Yeah, I think that's a great question, and it's a concern that a lot of people have expressed, and we have the same concern. So we've chosen to take the approach of how do we always, one, have a human in the loop. So we still want clinicians in the loop. We're never going to, or not in the near future, turn on AI and let it go without a human in the loop. So that's the first way. The second way is a deeper understanding of how the AI is developed, the models that it's trained on, what data sets is it built upon, et cetera. And I think that having some guardrails around that. And then the third one is what we talked about, really focusing on some of the non-clinical areas to start with, those administrative burdens, the documentation, some of the what we would call back office functions. And again, have clinician assistance with AI. So you still have clinicians making the decisions, but maybe the AI is assisting them or prompting them, and then allowing automation on some of those back office functions.
Yeah. As you look at integrating AI or really any technology and digital protocols at the health system, how important are partnerships? Maybe partnership with other medical concerns or private sector companies and that kind of thing. Is the importance of partnerships maybe heightened in this digital age?
Oh, 100%. I mean, we're at the core. We're a health system, right? We're physicians and nurses and APPs and pharmacists. We have some technical expertise, but we don't have the technical expertise of some of the other industries. And so the level of partnerships is critical. And we can be better together. That's really the mantra that we promote. We feel like where we're positioned, we can give a learning lab, we can give an engaged workforce that will adopt technology to go solve problems across the country. And so our value proposition is this engaged learning lab so that we can be part of a bigger, better solution. And I think that's the value of the partnerships. And again, we have skills, industry brings skills to the table. And I think it's, again, our mantra is we're better together. Let's go solve the world's problems.
Yeah. So we wrap up here. I'd like to give you a chance to look into the crystal ball and maybe what folks can expect in particular here in Indiana these next few years when it comes to healthcare delivery. You mentioned there maybe is an inflection point coming here the next couple of years, some challenges and opportunities that might be out there. But as you look at the next several years, let's say 3 to 5 years for healthcare in Indiana, what do you think we're going to see?
I think we'll continue to see improvements on what we've built. Like I said, we've got the core foundation. And again, I've been all over the country. I truly believe that the care that's delivered in Central Indiana, I would put it up against anywhere else in the country. We have some of the best doctors. We have some of the best nurses at anywhere in the country. And I think what we need to do is figure out how do we deliver that care to more of the people that need it? How do we address that? Some of the vulnerable populations, some of the people that have been disenfranchised from healthcare. How do we get those? To our earlier conversation, how do we address some of the social determinants and bring that kind of public-private partnership together to address those? So I'm actually very bullish on healthcare in Central Indiana over the next 3 to 5 years. I'm very excited about what the future does. Now, does that mean we don't have challenges? No, we do have challenges that we have to address, but I think we can come together to really address those challenges and deliver better healthcare and better health for Hoosiers.
Yeah, give me in your view, maybe the one or two challenges that you mentioned, the one or two that maybe are top of mind to you and others in the healthcare profession.
Well, I think the number one challenge is the cost of healthcare is expensive. We have to figure that out. We have to figure out a better way to deliver care that at a more reasonable cost. The second is all the things that we just talked about. Technology. Technology is expensive. People expect to have technology in healthcare. So how do you integrate technology in an already high cost environment? And how do you make that more cost effective? And again, the third thing is we have to address the workforce. So I think those are the three biggest challenges that we have facing us. And again, the fourth one is probably the aging population like we talked about. But I think that the number one challenge we have to address is we have to address the cost of healthcare.
Dr. Patrick McGill is Executive Vice President, also Community Health Network's Chief Transformation Officer. And Dr. McGill, been a real treat. You've provided some wonderful perspective on healthcare delivery, in particular here in Indiana. And really appreciate you taking the time to join us on the podcast.
It's always a pleasure. Thanks for having me on.
All right. And thank you for joining us on this episode of the Business and Beyond podcast presented by PNC. It's a weekly conversation with achievers in business, sports, entertainment, and beyond. And you can download all of our episodes and get Indiana business news 24/7. All you have to do is go to InsideIndianaBusiness.com. I'm Gary Dick. Thanks for joining us. We'll see you next time.